Hi, I'm Jason Sean Bennett from the Exceptional Health Company. Let's talk for a little bit about heart disease, because heart disease is the biggest killer of people in the world. It's about 41% in most countries around the world dying of heart disease. And when you start to really look at heart disease and the precursors of heart disease, you'll find most of them are preventable. So I'm very passionate in our work and with our team here about that you can prevent dying from heart disease, and you can also treat and help to reverse your symptoms and improve your condition and even get off medications if you're committed enough. So the two big causes we know are high blood pressure or hypertension and atherosclerosis, which is, as we know, building up plaque, too much fat in the blood, slimming of the arteries, those kind of areas. So we've got that fat, plaque in the blood, and we've got the thinning of the arteries, and we've got high blood pressure. And if we look at all of those causes of cardiovascular disease and death, we start to go, well, hang on, those two causes we can reverse, those two causes we can treat. We get incredible results. We've had studies showing when you break people into two groups, study done by Cadwell Esselstyn in 2014, showed that when you had a group of people and you looked at them for 4 years and they followed rigorously two different dietary patterns, the dietary pattern following, which was a plant-based whole food diet, which means mostly or all of what we eat being plants and mostly or all of what we eat being whole foods. When we follow that kind of dietary pattern and we make lifestyle changes, we get a 95 to 97% success rate at lowering chest pain, at reversing heart disease symptoms, and we get around a 20% success rate at curing heart disease, reversing all symptoms and coming off all medication. And we compare that to the current diet or the standard diet in the same kind of research, and we find no result at all. In fact, we actually find people dying younger and earlier of heart disease with higher mortality rates. So we start to look at, well, what are the things that really cause heart disease? And we start to see things like junk foods and takeaway foods, eating large amount of animal products and meats, being constipated, getting weakness in the immune system in the bowel area, which is so important. We notice a lack of sunshine contributes to heart disease, a lack of exercise, so being unwell and being unfit as well, and just generally eating too much and being overweight. And of course, the last one, most important one of all, is a high stressful life and a high stress situations. So we start to look at what can we do about heart disease. We do notice there's a lot of things we can do. We can start to reduce things like meat and animal products. We can eat more of a plant-based whole food diet. We can remove things like coffee from the diet. If we look at what coffee does, we know that coffee and caffeine raises blood pressure. And we know anything that raises blood pressure is going to raise your risk of dying of heart disease and dying much younger than you need to. So anything that does that, we're wanting to remove if you've got that concern. So removing coffee is a really good step to lower your blood pressure. Removing those bad foods and the animal products and the meats and things like that. Alcohol as well. We know a massive contributor to heart disease is alcohol intake, and of course cigarette smoking. So key things in this area can be removed and lowered and improved with different things in our diet and lifestyle to completely and radically transform our risk of dying of heart disease. So can you do it? Yes, you can. Even if you've got genetics in the family with a high level of heart disease in your family, there's even been research showing that they can be overcome by a plant-based whole food diet rich in fruits and vegetables. So is there possibilities here? Yes, there is. Can we have a look at the research? Yes, we can. There's a lot of research right now here. Have a look around our site, find the research, have a look, be in touch with us, and do some of our programs if you'd like to work with us.